Let's see a question related to this. Question is, a patient with hypocalcemia is most likely to exhibit which phosphorus level? Options are A, high phosphorus level, B, low phosphorus level, C, normal phosphorus level, D, fluctuating phosphorus level. Have you ever played on a seesaw? One side goes up and when the other comes down, isn't it? So, well, guess what? The same thing happens with calcium and phosphorus in your body. Today, we will break it down in a way you will never forget. Let's go. So, now your body needs both calcium and phosphorus for strong bones, nerve function, and muscle contraction. But here is the trick. What happens to the calcium and phosphorus in your body? It is nothing but the seesaw effect. When the calcium goes up, the phosphorus must go down, and vice versa. That means when the calcium goes down, the phosphorus goes up. So this balance is maintained by the body to ensure the healthy bones and metabolism. So the calcium and phosphorus relationship is just like a seesaw, the seesaw effect of calcium and phosphorus relationship. Now, let's dive deeper into the scenario. And hereafter, this discussion will be more helpful for the nurses who are appearing for the licensure exams like your DHA HAAD, Prometric, etc., where you will have more application level questions. Okay, so we have been discussing about the calcium and phosphorus relationship. They have an inverse relationship due to parathyroid hormone. There it comes. You must understand, okay, how the parathyroid hormone or the body control the calcium and phosphorus level. So the parath hormone, whenever the calcium is low in your body, the hormone increase the calcium level in your blood. So that is the function of parath hormone that you want to remember, throughout. Now, the parathyroid hormone regulates the relationship as I told you before. Now, let's see the first scenario. When the calcium is low in your body, the body releases parathyroid hormone, and thereby what happens, it will increase the calcium level in your body. How it will increase the calcium level? By pulling all the calcium from the bones, and it will increase the gut absorption of the calcium into your blood, so thereby the calcium level will be increasing. But what happens, it will decrease the phosphorus level by telling the kidney to excrete more phosphorus out, so thereby the phosphorus will be lower. So that's how the uh, maybe you must say it is the calcium and phosphorus inverse, and that's what it happens. Okay, now next come to the scenario. It is when phosphorus is high. When phosphorus is high, what happens? The parath hormone will be less. Okay, so what happens, it will prevent the calcium absorption. Once again, when phosphorus is high, the body reduce the calcium absorption and keeping them a balance. Which are the key organs involved or we discussed about the calcium and phosphorus balance? So the bones, which is very important because it store the calcium and phosphorus. Kidneys are the other one because it excrete the phosphorus and absorbs calcium. Intestines, which is playing another very important role, thereby absorbs calcium from the diet. So these are the key organs which involve in the calcium and phosphorus balance. All right, nurses, it's a time for some real world cases. Okay, so whatever you have studied, you have to correlate with your patients and the condition. Now, the first one is chronic kidney disease. We have already discussed the importance of kidney in relationship of calcium and phosphorus. So, what happens in the CKD? The kidney fails to excrete phosphorus. Okay, so the kidney can't filter the phosphorus, so the phosphorus will rise and the calcium will be dropping. Okay, so the patient with CKD, we expect high level of phosphorus and calcium low. So what you have to do as a treatment will be, these patients often need phosphate binders and the calcium supplements. So this is the first scenario in relationship with calcium and phosphorus. Now we move on to the second scenario, that is hypoparathyroidism. Okay, so we have heard the parath hormone. So hypo is less active, less parath hormone. What happens if the parathyroid gland is not working properly? The PTH will be low, which means calcium is low. Okay, so the PTH, not sufficient PTH means the calcium is low and the phosphorus will be high. That's what we expect in the hypoparathyroidism. And definitely the treatment would be calcium and vitamin D supplements. So this is the real world cases. And just adding one more, so you can just see this, okay, and you can correlate with the real life scenario in the chronic kidney disease, how the calcium and phosphorus relationship and what are the key causes of that. It will be helpful for you to have a better understanding of the condition and especially answering for your licensure exam. Now, Let's lock the thing that we have studied into your memory. Okay, so if a patient has high phosphorus, what happens to the calcium? Yes, it decreases. And what hormone controls the balance? It's parathyroid hormone. And which organ is responsible for excreting phosphorus? Yes, it's kidneys. Now, try to answer the question again. A patient with hypocalcemia is most likely to exhibit which phosphorus level? No doubt, isn't it? It will be high phosphorus level. Isn't it that simple? So don't forget the seesaw effect of calcium and phosphorus. Great job, future nurses. Now you are one step closer to mastering electrolytes. So if this video was helpful, hit the like button, share with a friend, and subscribe the Nursing Exam Insight channel for more nursing tips. See you in the next video. Thank you so much for watching.